Hi, my name is Fiorella Cornell, and I will be presenting abdominal aortic aneurysm. Typical patient presentation. A 74-year-old retired male who is a former smoker consulted a doctor of chiropractic for chronic low back pain. The history and physical examination confirmed chronic sacroiliac and a lumbar facet dysfunction. After 5 weeks, the patient stated he had stomach cramps. After this, a more thorough abdominal examination was done. The doctor of chiropractic detected an enlarged pulsatile mass upon abdominal palpation. Etiology of AAA. The exact cause of AAA is unknown. However, there are multiple factors that may contribute to and could increase the risk of AAA, in other words, abdominal aortic aneurysm. An AAA is a localized widening in the part of the aorta that runs through the abdomen. The abdominal aorta eventually ends up widening its diameter to 50% larger than normal its diameter. The walls of the aorta become weakened and can swell and bulge, causing an abdominal aortic aneurysm. An abdominal aortic aneurysm is an enlarged area in the lower part of the major vessel that supplies blood to the body. The aorta runs from the heart to the center of the chest and abdomen. Several things can play a role in the development of an abdominal aortic aneurysm, including hardening of the arteries, also known as atherosclerosis, which occurs when fat and other substances build up in the lining of a blood vessel. High blood pressure can damage and weaken the aorta's walls. Blood vessel diseases. These are diseases that cause blood vessels to become inflamed. Infection in the aorta. Rarely, a bacterial or fungal infection might cause an abdominal aortic aneurysm. Trauma. For example, being injured in a car accident can cause an abdominal aortic aneurysm. Background. Mortality, if ruptured, is about 85% to 90%. Present in approximately 1% of men aged 55 to 64 years of age, and its prevalence increases by 2% to 4% per decade. 4 to 6 times more common in men than in women. Men tend to develop these approximately 10 years earlier than women. 15% to 25% prevalence of AAA in persons who have immediate family members with AAA. Background continued. More than 90% of people who develop the condition have smoked at some point in their lives. Most of abdominal aortic aneurysms are asymptomatic, usually detected on a normal physical exam or imaging studies for other reasons. The rate of rupture is related to the aneurysmal size and rate of enlargement. Risk factors. Smoking can cause damage or weaken the aorta wall or lead to high blood pressure. Smoking is the strongest risk factor for aortic aneurysms. Smoking can weaken the walls of the aorta, increasing the risk of aortic aneurysm and aneurysm rupture. The longer and more you smoke or chew tobacco, the greater the chances of developing an aortic aneurysm. Atherosclerosis is a condition where fat and other materials build up in the lining of a blood vessel, as mentioned before. Advanced age, which are older than 65, the male gender, and family history of AAA. Having a family history of abdominal aortic aneurysm increases the risk of having the condition. Hypertension can weaken the wall of the aorta. Caucasians tend to have it more. Alcohol causes inflammation. Pathophysiology. Occurs when the walls of the main blood vessel that carries the blood away from the heart, also known as the aorta, end up bulging or dilating. Typically, aneurysms can occur anywhere by the aorta, but the abdominal is the most common location. Abdominal aortic aneurysm tends to occur when there is a failure of the structural proteins of the aorta. Pathophysiology continued. The cause as to why the proteins fail is unknown, but it results in the gradual weakening of the aortic wall. The structural proteins of the aortic wall, such as the elastin and collagen. The composition of the aortic wall is made up of the collagen lamellar units. The number of lamellar units is lower in the infrarenal aorta than the thoracic aorta, which causes a higher incidence in aneurysmal formation in the infrarenal aorta. Pathophysiology continued. Usually, AAAs that are intact tend to cause no problems. However, when a large AAA bursts or ruptures, it can cause heavy bleeding into the abdomen and possibly death. The aorta is particularly more susceptible to aneurysm formation because of the constant stress on the vessel wall and absence of penetrating vasorum in the medial layer. Symptoms. Commonly asymptomatic, but some symptoms may include a pulse feeling near your navel, also known as belly button, constant abdominal pain, back pain. However, if an AAA is ruptured, it may portray the following symptoms: sweating, intense heart rate, nausea, dizziness, constant abdominal pain, and vomiting. Abdominal ultrasound is one of the diagnoses, and it's also the best diagnostic tool. Abdominal and pelvic CT. CT is the computed tomography, and angiography. The diagnosis of an abdominal aortic aneurysm is usually made with ultrasound. CT scan is needed to determine the exact location, size, and involvement of the other vessels in imaging of choice in symptomatic patients. On the left, we see a normal aorta. On the right, we can see an aorta with an abdominal aneurysm. I also included some ultrasounds to help give it a better view. This is how a normal aorta should look on an ultrasound. It has its regular size. It is a dark circle in the middle. However, in this ultrasound, the aorta is enlarged, portraying an abdominal aortic aneurysm, as shown in the middle. Treatments. The goal of abdominal aortic aneurysm treatment is to prevent an aneurysm from rupturing. Treatment may involve careful monitoring or surgery. The treatment that you have depends on the size of the aortic aneurysm and how fast it's growing. Treatment is recommended when the aorta reaches 5 centimeters to 5.5 centimeters and it enlarges rapidly, over 0.5 centimeters over a span of 6 months, or if it's symptomatic. Small asymptomatic abdominal aortic aneurysms are left alone but tend to be watched to view the changes in size via ultrasound examination of the abdomen every 6 months. If an AAA is 5.5 centimeters or larger, it will be repaired surgically through open surgery or an endovascular stent graft. Treatment continued. I listed a description of each of the 2 different types of surgery. For example, open surgery is removing the section of the aorta that has become dilated and replacing it with a prosthesis that is made up of synthetic material. as you can see on the left image. In the vascular stent graft, you make an incision in the groin, which ends up exposing the femoral artery, and then placing a wire in the vessel, and then multiple catheters are used to pass a folded stent graft to where the AAA is located, as you can see on the right image. I also put a comic that will hopefully help summarize and memorize what an AAA is. Thank you for listening.